This is Suzanne Swank, student number M1712220COS, and this is my practical lab for skill number 3, determining patient consultations for inhaler use. Okay, I am filling prescriptions, and I get a prescription that comes across for a 90 microgram metered dose inhaler Pro Air HFA. That would be this inhaler here. Yes, 90 micrograms per actuation. This is it. The expiration date is 04 of 2033. That is correct. So we have that label here. And we will attach the label to the box, and we will wait for the patient to come and pick it up. Oh, hello, sir. How are you this afternoon? You're here to pick up a couple of prescriptions? Absolutely. What's your name, sir? James Frank, and your birthday, please. 05/31/1980. All right, thank you, sir. And can you verify your address for me, please? Yes, 1592 Northeast South Lane Street, Sunnyside, Michigan, 48026. Thank you very much. It shows that we were sent in 2 prescriptions for you. One of them, the Advair 250 Discus, that is an inhaler. We are currently, unfortunately, out of stock on that one. As soon as it comes in, though, we will get that filled for you and notify you so that you can come pick it up at your earliest convenience. After we fill that one for you, you will have 1 refill remaining on that. But we do have an inhaler or a prescription ready for you. It is another inhaler. It is the Pro Air HFA inhaler. It is this little small inhaler here. You'd like to know how to use it? Absolutely. There are 5 refills remaining on this. So, there are plenty of refills. Now, the way to use this is you want to shake it up before you use it. That way everything is nice and mixed in. You want to take this off the mouth cover, and you want to put the mouthpiece in your mouth. Hold it between your thumb and forefinger or middle finger, whatever is more comfortable for you. And then with the mouthpiece in your mouth, you want to give it a push down, and it will make a little puff. You want to inhale that. Hold your breath for about 30 seconds. Exhale. And your prescription reads that you should have 2 puffs every 4 hours as needed. So you would do that a second time for your second puff, and you're able to do that every 4 hours. Should you clean it? Yes, it can get a little germy putting this in and out of your mouth several times a day. So in order to clean it, you would take the mouth cover off. You would take the medication out of the unit here. Turn your water on in your sink. Make sure it's nice and warm. Once you have your warm water running, let it just flow into the top of this and out the side for about 30 to 45 seconds. Take it out of the running water. Make sure you get all that out. And then turn it on its side and then put it back under the running water. So the running water is running into the mouthpiece and out the top. Let it do that for about 30 to 45 seconds, and then turn your water off. Shake the excess water out. You want to allow it to completely air dry before you insert the medication back into it. It is recommended that you do this at night before you go to bed, so it has all night long to dry out. And then you put your medication back in. There is a little circle in the center here. You want to line this tube up with that and seat it until it is firmly seated in there. And then put your mouthpiece back on there, and you are good to go. And you're ready to use it for another week or so until you clean it again. Are there any other questions? Okay, you'd like to know if this would help during an asthma attack. That would be a question for our pharmacist. Give me just a moment, and I will go grab our pharmacist for you. Thank you so much for being patient, Mr. Frank. This is Pharmacist Greg. He is here to answer all of your questions. Pharmacist Greg, we have gone over how to use and how to clean this inhaler, but he did have a question about whether or not this would help with his or with an asthma attack. Also, I did inform him that we were out of stock on the Advair Discus 250 and that we would call him and notify him as soon as that became available to us so that we could get that filled and he could come pick it up at his earliest convenience. Thank you, Mr. Frank. You have a wonderful day.